Good day everyone, my name is EJ and today I'll be performing LO3, which is search keyword effectively using Boolean operators through search engines and scholarly database. So my study would be applications of nanotechnology treatment for cancer. So these are the rationale and objectives. Feel free to pause, including the methods, info source, and search strategies and selection source of evidences. So here is my first keyword, nanotechnology used for treatment cancer and diagnosing cancer. So I'm going to use PubMed and advanced search of the PubMed or the Boolean operator itself and click search on the keyword. After this, here are the results and let's narrow it down through their timeline filter with our eligibility, of course, with full free text, randomized clinical trials review as well. Now let's move on with clinical trials. We only have two results for this one with the same search, of course, and here are the different filters and advanced searches that we can do to search up the result. Likewise with Cochrane library, it's similar with PubMed, so let's run a search using the keyword. Alright, it will be taking time, but okay, we don't have any results for the search results of the keyword in Cochrane library, which means we can't filter out the results. So basically on PubMed, the records identified through database are 15, which was the first search result. And of course, the record screened was 6. And the records that was excluded throughout the study during assessment was only 4. And the pass on the eligible criterion or the eligible articles that was left was only 2 that would be passing our study. Likewise with Cochrane in the same topic, but we have no results for clinical trials. Prior to this, I've already recorded some of the search engine results that was gathered earlier using the Prisma guidelines, of course. Second is the cancer diagnostics with nanotechnology, the second keyword. Now let's use PubMed. Let's run a search. Likewise with do filtering out 977, toggling in the timeline. Still, the results are too big. Let's lower it down, only resulting to 28. Likewise with clinical trials, we only have 3 with the same, of course, keyword and advanced filtering. Next, using Cochrane library. With Cochrane library, we only found 1 study, which is a trial and was published year 2019. And of course, these are the rest of the filtering methods for Boolean software. Of course, they can toggle the year of the study as well. For cancer diagnostics, of course, these are the tallied results. So basically from 977, the records that was screened was only 28 and the rest excluded was 16. And all the 16 articles that was sought through was eligible for the study or the focus of my study. Likewise with the rest of the searches. And last, for the nanotechnology competence with cancer. So these are the results. Feel free to pause. And these are the contrasts of the different platforms or search engines. So for the Boolean operator, of course, of PubMed, it used in advance. Of course, the search is easy to understand and can narrow down during the search results and depending on our need as a researcher. So the advanced filter is easy to use and can be seen right away, such as when you're toggling the timeline, and has a lot of filter selection needed for your studies and provide a lot of studies that can relate to your need as a researcher, likewise that I said earlier. For the Cochrane, the Boolean operator is somewhat similar to PubMed, easy to navigate, yet search results are always really low, and timeline toggle is easy to navigate and pre-selected and continue. And for the years, you can type out the years that you want to include in your study, and of course, the filters, each search result studies are already laid out above the search result and can be easily selected. So for the clinical trials, the Boolean operator search of the clinical trials is somewhat based, case-based and patient-based, including the patient's chart, info, and advanced search. And that will be all for my LO3. Thank you for listening.